have a question for you. Which country do you think has the best healthcare system in the world? About 80% of Americans rated their healthcare coverage as excellent or good. Well, the Organization for Economic Cooperation and Development is a group of 38 countries working to better international standards. And according to the OECD, compared to all of those countries, the United States has the highest obesity and chronic disease rate, yet the fewest number of physician visits. We have the highest rate of avoidable deaths, and our life expectancy is about 2 years less than the average. And we even have the highest suicide rate. Yet, the United States also spends the most money on healthcare of all of them. So, why are we sicker, dying younger, and seeing fewer doctors? Because we're missing an important piece. Our system is designed to benefit corporations, not the individuals, us. Our goal needs to focus on patient care. We should eliminate the fee-for-service model, redesign hospitals, and increase transparency of costs. Right now, the medical device makers and drug companies can charge as much as they want because there's no incentive to make it accessible for patients. For example, a few years ago, my dad had back surgery. And a few weeks later, he was sent a bill for almost $200,000. The doctors charged the most they were allowed, with no intent of him paying it, because they wanted to get the most money from insurance companies that they could. And because hospitals charge so much, insurance premiums rise, because the insurance companies still need to profit. It's a chain reaction, making it challenging for everyone to afford healthcare. Another instance of patient accessibility being sacrificed for drug companies' profit is insulin for diabetics. Right now, according to the Mayo Clinic, one vial of insulin can cost around $300 for the patient, but only about $4 to $6 to produce. And recently, this price has been increasing at a rate of about 15% per year. And this is only benefiting the corporations who make it. For patients who are insured, this rise in prices mostly means that insurance companies pay more and insurance premiums rise. But for patients who are uninsured, many have to resort to extraneous measures. According to a study at Yale, almost 1 in 4 diabetics have rationed insulin, and many of these due to concerns with costs. And rationing insulin can lead to diabetic ketoacidosis, symptoms of which include excessive thirst, nausea, vomiting, weakness, fatigue, shortness of breath, and in some cases, even death. All of this caused because some people are not able to afford a medication they need to live because companies prioritize profits. Our country's healthcare system needs to change. There have been thousands of bills proposed to fix small portions of the issue, but they're just Band-Aids. GovTrack is an impartial source created to help citizens stay up to date on what's happening in the United States Congress. I went onto their website and looked at the bills that have been proposed regarding healthcare this year. And once I put in those parameters, I was left with 1,379 bills. These are taking up the valuable time of our lawmakers, and the vast majority will never be passed. And the ones that are will likely never impact anybody here. The most famous healthcare reform bill was the Affordable Care Act, also known as Obamacare, which was instituted in 2010. It was a step in the right direction, but nobody is willing or able to address the problem as a whole because it would negatively impact large companies, and they are the ones with the money and sway in politics. Achieving a better healthcare system is also challenging in the United States because we live in a country built upon the ideas of freedom and capitalism. That means people are hesitant to give up the idea of healthcare being a for-profit industry or to put any mandates in place around insurance. But regardless of these challenges, with some hard work and unity, we can make our country better. To start, we should eliminate the fee-for-service model. This is where doctors get paid more if they do more. As it is now, it gives doctors the incentive to run unnecessary tests. So imagine if you're remodeling your house and you leave all your choices to your contractor. It wouldn't be crazy to think that they may bill you for more hours than necessary, double the cost of your flooring, or redo all your insulation even if it wasn't needed, because they would get paid more for each thing they do. Currently, this is the same in healthcare, and this system has the opportunity to exploit patients' lack of knowledge and vulnerabilities. If we took this away, we would live in a world where we know that the time and money we spend with doctors will be productive for our health. Next, most of the hospitals around us were built at a time when transportation was challenging. That means every hospital has to be able to do everything. Each hospital, especially the smaller ones, only have a few people and a little bit of equipment for each specialty. That means the knowledge and resources are spread out among hospitals all over the city. Our country could save money and achieve better outcomes if each hospital specialized in something. You may need to drive an extra 10 or 20 minutes, but the wait times would be shorter, there would be more people who know how to help you, and more machinery specialized to what you need done. If we made these changes, to be honest, our healthcare system still would probably not be as good as some other countries in terms of accessibility, but it would be worlds better than it is now. We could create a system that encourages people to seek help when they need it, because healthcare costs would not be a source of anxiety. Also, all of our life expectancies would go up, because fewer people would die of preventable causes. Who wants to live a few extra years? Well, not really, but these changes could extend the lives of millions of people. So, what can you do? To start, when accessing healthcare or paying your bills, take a second to pause and see how our system is benefiting or harming you. Secondly, vote for people who have a focus on healthcare. Specifically, the ones who want to make healthcare available for everyone by creating a pay-for-value model, redesigning hospitals, or even candidates who support a single-payer system. They would likely not succeed in creating a single-payer system because they would have trouble gaining support from our capitalist society, but they would be pushing our system in the right direction by making some of the changes I advocated for. A benefit of these candidates is that many of them also support increased transparency of costs. This would be helpful because it would allow everyone to make more informed decisions over where they receive their care, and it would force companies to keep their costs in check. This particular change does not go against the United States capitalist nature, and we wouldn't even be the first to advocate for any of these. We need to follow the actions of Stacey Abrams, who's running for governor in Georgia, and Kathy Hochul, who is the governor of New York. Abrams is attempting to expand health insurance, and Hochul to expand the industry and decrease staffing shortages. We just need to follow in their lead to make sure everyone has their healthcare needs met without anxiety, and everyone is educated on the costs and effects of their choices. All in all, the missing piece in the United States healthcare system is a focus on the patient. While it may not be ideal for all groups, we need to come together as a country to make the basic need of healthcare available to everyone. Thank you.